Hi there. Come on in, take a seat. Welcome to the clinic. My name is Dr. V, and you might be... Okay, yeah, let me just get you into our system. You don't look to be in great pain or anything. Is this an emergency? Okay, great. Well, not great that you're here, but great that we don't have to be urgent about it. Your first name, please. Okay, thank you. And your last name. Gotcha. Okay, and could you please just tell me your date of birth? Okay, great. Well, what brings you into the clinic today? Oh, interesting. So your vision is just blue? Okay, are you capable of seeing any other colors? You're not sure. Okay. Interesting. And how long has this been going on? Just suddenly happened one day. Okay. And no recent injuries, head injuries, any sort of trauma? Okay. And has anything like this happened to you before? Not necessarily your vision turning blue, but getting floaters in your eyes, seeing double vision, any sort of sudden vision changes? Okay. Sleeping habits are normal. Anything changing there? Okay. Diet. Okay. Any known allergies? Okay. And do you have any history in your family of any ocular issues? Okay. When was the last time you went to see a doctor? Any? Okay. Gotcha. Okay, and nothing new there. They didn't ask for a CT or anything. Okay. Well, we'll take a look and see what we can find. I have to be honest, this is a new one for me as well. But we'll see what we can do for you, because blue is a beautiful color, but I mean, we would like for you to be able to see all of the other ones as well if possible. So let me just get you into the system here. Okay. And I will just kind of get a workup on you and see what we can figure out, okay? Great. Let me just put on my gloves and we can get started. Other than your vision turning blue, how is your day going? Okay, well, that's good then. Thanks for coming in. I appreciate it. Some people might have just decided to be okay with blue vision, so... Alright. Sorry, my hands are a little bit sweaty today, so sometimes it takes a little longer to get the gloves on. Alright, so would you mind just taking a deep breath in for me? I'm just going to place my hand on your back here. Just in. And out. Good. And another one in. And out. Good, okay. And I'm just going to place my hand right here. And go ahead and take a deep breath in and out. Good job. Okay, now I'm just going to grab your pulse. So I'm just going to put my hand right here, and you'll feel a little bit of pressure. Ready? 2. Okay, great. Thank you very much. Just enter that into my system. Okay. Would you mind just blowing as hard as you can out of your mouth and hit my fingers here in 3, 2, 1. Good job. Okay, and again. 3, 2, 1. Good. Okay. Now, I'm just gonna check how your muscles are feeling, if you're feeling tense anywhere. So just go ahead and stay still for me. Just going to press at your temples here. This is like the top of your jaw. Just gonna press here. Good. And open your jaw. Good. Just gonna press down your jaw here. And could you relax your jaw? I'm just going to wiggle it gently. Okay. And clench. Good job. Okay. And your orbital muscles here. Just kidding. Would you just push your cheeks out? Good. And suck them in. Good. Okay. Now, go ahead and try and close your eye. Good. And this one, go ahead and try to close your eye. Good. Interesting. Alright. Could you give me a big smile? Okay. That's all normal. Perfect. Okay. So now I'm just going to check out your ears. So if you wouldn't mind just staying still, I am just going to take a quick look in your ear here. So just stay still. Just checking all of your cranial nerves, making sure everything is functioning the way they're supposed to in case this is connected to something else. Okay. Good there. The other side. Just going to check. Okay. Alright, that all seems normal. So I'm going to ask you to just give your eyes a quick close. Good. Can you tell me what side of your head the sound is coming from, left or right? Okay, and this one. Good, and this one. Okay, and this one. Alright, which one is closer, left or right? Okay, which one is closer to you, left or right? Okay, which one is closer to you, left or right? Okay, which one is closer to you, left or right? Good. Which one is closer, left or right? Okay, which one is closer, left or right? Good. Which one is closer, left or right? Okay, very good. These were the same distance apart, so very good there. Okay, now can you please count how many times you hear this tweezer sound in your left ear? Okay, very good. Ready? How many times? Okay? And again, but now how many times do you hear the tweezer sound in your right ear? Okay? Good. How many times was that? Very, very good. Okay, and again, let's do your left ear one more time. How many times do we hear the tweezer sound in your left ear? How many times? Good job. Okay, you may open your eyes. Hello. Alright, now, could you please smell this? Take a big inhale. And tell me what it is that you smell. It smells like flowers. Okay, good. And does this pencil cap smell blue to you? Interesting. And what about this marker? What scent does this smell like? It smells citrusy, exactly. Good job. Okay. So I am going to have to take a good longer look at your eyes since this is affecting your vision. So first I'm just going, took off a little bit too much of this little individual piece here. Okay. I'm just going to look into your eyes here. So go ahead and just look behind me here. Look behind me. Look behind me. Okay. Okay. I'm going to get a close look here. Okay. Good. Okay. And the other eye. Just going to take a closer look at the eye here. Let me just see from back here. Again, just looking behind me. Okay. Interesting. Nothing immediately alarming there. I'm going to run a little bit of a test here. So, could you please look into this little diamond, okay? Look into the diamond. Okay? And look into the square. Good. Now look into the diamond. Good. Now look into the square. Good. Now, can you see a colored shape behind these shapes? Like the outline of them. When I place the light, can you see an outline behind them? Okay. Can you tell what colors they are? Or are they both blue? Okay. And now, I'd like for you to look into the longer rectangle. Okay? And the shorter one. Good. And looking back into the shorter rectangle. Good. And the longer one. Alright, and same for these. Can you see the outlines when I place the light behind here? Can you see the outlines? Okay. Now, can you tell what colors they are? These are a little more difficult. Okay. Understandable. Those are more close to shades of blue than the tops. So that makes sense. Alright. Now, I'm just going to take a closer look at the inside of your eyes here. So I'm gonna just go eye to eye singularly. So go ahead and just look up for me. Looking up. Good, and looking down. Good, and looking left. And looking right. Okay. Now, can you do me a favor and just move your eyes from left to right, okay? This light will be stationary. Just move them from left to right, back and forth, back and forth, back and forth, back and forth. Good. Okay. And just going to do the same thing here. So go ahead and look up. Good, and look down. And look to the left. And to the right. Okay, and same again. Go ahead and look up and down. Up and down. Good. Looking up and down. Up and down. Good. And look up, down, up, down. Good. And one more time. Look up, down, up, down. Very good. Okay. Let me just take a quick note here. Okay. So I have a couple of color slides here. Let's start with this one. Let's see. What color do you see here? It's looking a little purpley blue. Okay. Are you able to see the difference in shade between your regular vision and this color? Okay, interesting. And how about this color? Are you able to tell me what color this is? Good, okay, this is green. Very good. Alright, perfect. That's good to know. And the last shade here. Can you tell me what color this is? Very good. That is red. Okay. So your rods and cones are functioning. I'm wondering why it is then that they seem to be stuck on blue. Very interesting. Okay. So to test this, I have this little board here. So I'd like for you to tell me. I'm going to move these all to blue. Just give me a minute here. Okay. So these are all currently covered in blue. Could you tell me what this picture is here in the top corner? Are you able to see the picture? Okay, and now when I remove the blue here, is it easier for you to see the shape? Okay, and again with the blue. Okay. Can you tell me what the shape is? Good, that is an accessible sign, so very good there. Let's look at this shape here. What is the shape? Try not to read the words below it. Okay, and now, without its covering, are you able to tell me, is it easier or more difficult to see it now that it is uncovered from blue? Interesting. Okay. How about, can you tell me what this is right here? Can you tell me what that is? Okay. Okay, good. And now, is it easier or more difficult to see it with the blue covering? Okay, so that is a church. Very good. And above it, can you tell me what this is? Okay, good. That is a dog. And now when I cover it, is it easier or more difficult to identify it? Okay, very good. And what about this one here? Can you tell me what that is? Okay, so that is a fire hydrant. Can you tell more without the blue covering? Okay. And what about this here? This one. Could you please tell me what kind of truck you think this is? Good, okay. This is a dump truck, one of those trucks that can pour backwards. Are you able to identify it better with or without the blue covering? Okay, good. And what about this one here? What do you think that shape is? Okay. And is it easier to identify with or without the blue covering? Okay, so the flag is easier without. Okay, so that feels a bit like that would make sense. Just enter that in there. Okay, now could you please just focus on this wooden stick? Could you tell me what color the wooden stick is? Okay, now keep your focus on it. Keep your focus on it. Keep your focus. Good, good, good. And keep focusing. Keep focusing. Keep focusing. Good, okay. And now this stick. Can you tell me what color you think this stick is? Good, okay, this is red. Does it look very obviously red, or was that a challenge for you to identify? Okay, go ahead and follow it. Follow it. Follow it just with your eyes. Good, good. Follow it. And keep following. Following. Keep following. Good. And lastly, can you tell me what color this is? Interesting. Okay. You're having a hard time distinguishing between pink and purple. Keep following. Tell me if the color changes. Okay. So it does a little bit. Got it. Okay. Very good. Now, I just need to find my tool here. There we go. Okay. Could you please follow the light with your eyes only? Good. Keep following. Okay. Thank you. I'm just going to lightly press underneath your eyes. Let me know if you're experiencing any sort of discomfort. Okay. Ready? I'm just going to poke. 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 And poke. 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 Did that give you any sort of discomfort at all? No? Perfect. Okay, now I'll be poking right above your eyes, kind of on your brow bone. Poke, 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 poke. Any discomfort or pain at all? No? Perfect. Well, I've narrowed it down to a couple of things, both of which can be treated with this anti-blue serum. It is something that sounds like it would have been obvious, but you have to just diagnose and make sure that it's not anything else. So I'm just going to put a little bit of this on your tongue, and it should start taking away the blue in the next couple of hours. And if it doesn't, let me know and we will do a little more troubleshooting, okay? Great. Okay, so we're just going to give you a couple doses of this. So go ahead and just open up your mouth for me. Good. And I'm just going to... Okay. And... There we go. Okay, go ahead and swallow that. Good. Alright, well, thank you so much for coming into the clinic. I have never experienced blue vision before, so this was a first for me, but I'm happy that we were able to make sure it wasn't anything very bad or malicious. We are just going to see how that anti-blue serum goes, and hopefully that will help you out, and if not, of course, come back, okay? Okay. Thank you so much for stopping by.